recording at this moment. And I'm very happy that today we will look at the radicalization or extremism a little bit different way than we usually are used to. This is Cynthia who will bring us this new perspective. So Cynthia, the floor is yours.
Thank you. Thank you very much. I don't know what your normal practice is. If you would normally want to do introductions first, is that helpful? Does everyone know each other? I know we're not a very big group, so it's Azusa, I will let you decide what you think.
I think we can make a short introduction because it's very interesting group of people who gathered here. So I would just ask people according to as I see them in my screen. So Lucas already presented himself, me as well. Michelle, please. Just say
hello, my name is Michelle. Now I'm doing my internship in PDCS.
Okay. Dushan. Microphone, please.
My name is Dushan and I work in PDCS as consultant and trainer.
Thank you. Lena Theodolides.
Hello, I'm working at the Maciej Bell University at the Economic Faculty.
Banská Bystrica, Slovakia.
Yes, Banská Bystrica, Slovakia. Yes, thank you, Zuzana.
Vladislav.
My name is Vlado and I work at Center for the Study for Democracy in Sofia, Bulgaria. I'm also doing a PhD on radicalizations and violent extremism among young people in Bulgaria. So that's it, basically.
Wonderful, thank you. Ivana.
Hi, I'm Ivana and I'm also from PDCS.
Vera.
Hi, I'm Vera from PDCS, where I'm facilitator and trainer.
Thank you. Lucia.
Hi, I'm Lucia. I'm working also in PDCS in a totally different area, but interested in this topic. So,
thank you. Veronika Kolbiasz. Veronika. I think it's some problem. Yeah. Is it working, Veronika, or not? Maybe we jump to another person and then we get back to you. Or is there any chance we can hear you? Not really. Okay. Check. We cannot hear you, Veronika.
Hi, Veronika. I'm Poland in Cultural Center. Yeah, I told everything. One more time. Veronika, I don't know. Yes? Maybe I have problem with the internet.
Okay. Thank you, Veronika. Michael Colborn.
Hi, my name is Michael Colborn. I am a journalist and researcher at Bellingcat. I'm from Canada, but based in Amsterdam, the Netherlands.
Thank you, Michael. Stanislava.
Or Stanka for short, and I'm from the city of Bratislava from the Prevention, Harm Reduction, and Social Services.
Thank you. Jennifer?
Hello, everybody. I'm Jennifer Harper, and I'm a US-based researcher specializing in accelerationism and youth radicalization.
Wonderful. Thank you very much. Jacek Purski.
Hello, nice to meet you all. I'm Jacek. I'm from Poland. I'm a chairman of Institute of Social Safety, and I also work for Radicalization Awareness Network as a co-leader of Run Local. Thank you.
Wonderful. Jacek, I hope you're not driving so that we will not be responsible for any accident.
Don't worry, don't worry.
Thank you. Thank you, Boba.
Hello, my name is Boba. I work for a platform for development organizations called Umbrella, and it's 1 a.m. in the morning, so I will keep my camera switched off. Sorry
Yes,
for that.
thank you, Boba, for joining us. And probably you are we are really global group here.
I'm
because
happy to be with you.
US,
Thank you.
New Zealand, Europe, everything is here. So okay, who else? Martina Dominic. Martina, can you say something about yourself? Thank you, Veronica, for putting in the chat everything about yourself. Now it is clear. Thank you very much. And Mrs. Skobzova.
Hello, can you hear me?
Yes.
My name is Sylvia. I'm working for IOM Slovakia, in particular in the Trenčín, and I'm employment and social counselor. If you don't mind, I will also switch off my camera. I don't know, perhaps you can't see me, but I'm happy I could participate.
We cannot see you, but we can hear you very well, and that's great. Thank you very much. Martina Dominic, we were not able to hear you. Let's give another try. And if not, please, Martina, write into the chat a small introduction. Where are you from? If it is possible. Thank you very much. And I think, did we forget anybody? I think we had all of us introduced.
Okay, terrific. That's very helpful for me just to know who's with us and what roles you're playing and organizations. So I want to thank Zuza and Lucas for the invitation to be here. It's terrific to be in this group. And I am going to share my screen. I will have some slides here. So let me just find the, sorry, I have a lot of tabs open and just have to find, here we go. All right, so hopefully you can see that now.
Yes.
Okay, good. If so, it's, as you probably know, it's difficult to pay attention to the slides and also see anything coming up in the chat. So Zuza, maybe if something is in the chat that is a clarification question or something that would be useful for me to stop speaking, then please let me know and just speak up so I can hear you. I will say what the plan is today. I understand we have about 90 minutes together total, now a little less, but I'm going to spend maybe about a half hour, 35 minutes reviewing some content where I have to review a little bit of content on the context of far-right extremism and terrorism and its growth trajectory, just to understand how the responses in the counter-extremism world are a mismatch right now, and what we're seeing in this public health style shift. So the US has now officially embraced what they're calling a public health style response. That is something my research lab has been calling for many years, for some time, but I have some concerns about the superficial nature of some of the application of the concept. And so it's a really good opportunity to talk about what is a public health approach, what does that mean, and what is required to do it in a rigorous way, as opposed to a kind of more superficial way. I think it's possible to steer in the wrong direction when you first adopt it. So I'll talk about that. So my goal is, very briefly contextualize what's happening. Specifically, my expertise as an individual scholar is on the far right. And so I'll be talking primarily about the far right, but I'm happy to address whether and how I think this approach would apply to other forms of extremism as well. I'll briefly review the recent developments in new growth dynamics because they're really important for explaining why we need a different type of approach. And then what I really want to spend the time on is the shifting response. What does an ideal public health style prevention framework look like? And then after my talk, we'll have some time for question and answer, but we'll also split into groups. And I have a few questions for discussion that you'll take up in smaller groups to discuss to make this a little interactive. And then we'll come back for the final discussion altogether. So there's a lot of text here that I don't want you to read, but just to tell you how I define the far right. This is a screenshot from the Global Terrorism Index's definition, which essentially says the far right is a combination of exclusionary supremacist beliefs that set up a hierarchy of superiority and inferiority across groups, and some type of anti-government authoritarian practices. So I use it in both ways. And I think one of the important things to note about the use of the far right in my definition and in our research lab's definition is that it that we include male supremacism and also Christian supremacism and Western supremacism, not only white supremacism. So that sometimes is a little bit different than how European groups like the Center for Research on Extremism in Norway, their historical definitions have not been as expansive in talking about the far right. So, but I think my argument is it's very important to look at these as intersecting forms of supremacy. And particularly when we see groups like the Proud Boys, for example, who define themselves as Western chauvinists, so they're Western supremacists. They are not officially espousing a white supremacist framework, but it's still a supremacist framework. There's still an us versus them way of thinking. There's a hierarchy of superiority and inferiority, and there's very similar kinds of characteristics. So there's a lot of different drivers that I won't talk about today, but I'm happy to get into. I think it's really important to note that when we talk about the far right in the context of terrorism globally, despite the fact that it's growing rapidly, it is the fastest growing form or the most dangerous form in most countries across Western Europe, Eastern Europe, North America, New Zealand, Australia, but it is still a tiny fraction of global terrorism deaths. So when we're talking about global terrorism, we still have to understand this is still quite a small number of deaths, and the lethality is much bigger in other forms. However, obviously there are reasons why I focus on it, and I just want to note that I think it's important to note that this is still, compared to what's happening in other parts of the world, this is a relatively small portion of what's happening in terrorism. And so a lot of security agencies continue to spend a lot of their time on other forms. Definitions of what constitutes actual terrorism, by the way, is also not consistent, and that complicates some of these statistics. But just to show you a little bit of the statistics, when you're looking at far-right violent extremism, this data set hasn't been updated. This data set just updated the last 2 years. So this is still from pre-pandemic, which I think is also important for a couple of different reasons, but up through 2019, it's important to note that about half of the incidents and half of the deaths were in the US. So the US does carry a disproportionate amount of the deaths. Some of that is because of firearms, of course. But we also produce a lot of propaganda on the white supremacist side. We export the majority of supremacist propaganda, according to some analyses. And we're also exporting a lot of QAnon conspiracy theories, which actually is really interesting to note that during the pandemic, we saw some shifts. So the largest group of perpetrators during the pandemic were conspiracy theory extremists in the US and in Western Europe. That's 85 attacks total, but only 1 death. And so it didn't get as much attention, I think, because the lethality has not been as high or as strong, but there's a lot of extremist plots happening on the conspiracy theory side during the pandemic. And so the data is going to be a little bit funny for a little bit for a while. I will say, just again, in the US where I work and where this public health framework emerges primarily from, I think, missteps in how we're treating this problem in the US, we very belatedly recognized the problem. It was only in the fall of 2020, under the Trump administration, actually, that the US Department of Homeland Security finally acknowledged that domestic violent extremism is the biggest threat facing the homeland. White supremacist extremism is the biggest threat within that landscape. And now new data in the Pierce data set from the START Center at the University of Maryland documents a 1900% increase in mass casualty plots in the US in the last 5-year period compared to the 1990s. So we are seeing significant increases. I think the FBI investigation report said 347% increase just at the end of February was their most recent analysis. So essentially the way I usually describe this is on every measure we have available, we have record-breaking hate crimes, we have record-breaking circulation of white supremacist propaganda, we have record-breaking mass shootings, already 130 mass shootings in the US this year, including an awful one this week in an elementary school. We have had, and not all of those are far right, but the kind of mass shootings, plots, attacks are up across the board, and much of that is tied to hate, conspiracy theories, disinformation, and propaganda related to the far right. This is what I want to emphasize, though, in thinking about interventions. Most far-right terrorism and violent extremism does not come from groups. So the violent acts, about somewhere between 7 and 15% of far-right terrorism, depending on what database you look at, is tied back to an actual group. So the vast majority of violent acts are individuals. They're not, I don't like the term lone wolf because it implies that they're totally isolated, but these are individuals who are radicalized primarily in online contexts in networks of other people. They're often consuming propaganda that's created by groups, so the groups are still important, but it's very difficult to use traditional counterterrorism strategies, which have involved groups, infiltration, monitoring, surveillance, interruption of plots that are organized by people. It's very difficult to use that as a primary strategy or as an only strategy when most of the violence that is successful is not originating in a group. And so that's part of what we're facing. I'm going to skip this slide just to get to the growth dynamics here. We are seeing, and these slides are about the Boogaloo, which is, the Boogaloo is a far-right, primarily far-right movement. It's a Civil War-oriented movement in the US, kind of a, it's not even really a movement, I call it a mobilizing concept. And this gets at the really difficult way of explaining what's happening here. So the Boogaloo emerged around 2019 out of a joke created by teenagers online who used the term Boogaloo to refer to, because it came from a title of a breakdancing movie in 1984 that was the second, a sequel. And so they began to use it as the second of anything, and eventually it came to mean the Second Civil War. It was taken up by not teenagers, but actual grown-ups who then started dressing up in kind of tactical gear, SWAT gear, using the concept of Boogaloo to organize groups they called Boogaloo Boys, and going out and protesting and forming protests around a second civil war. Facebook banned all the Boogaloo groups in May 2020, and so they started using sound-alike words like Big Igloo or Big Luau. And then the Big Luau became popular in its own way because it features pig roasts at luau's and in Hawaii. And so you see this meme here with a ATF, which is an insignia for a law enforcement organization division, and they started wearing Hawaiian shirts. So this is what I mean by the evolution of kind of meme-based, what they call meme-based insurgency or meme-based mobilization and radicalization. In the summer of 2020, I think Boogaloo groups and individuals associated with the Boogaloo were associated for a handful of deaths, with a handful of deaths in the US. So they were attacking law enforcement. There were plots, there are trials ongoing. They've been, caught and arrested. But it is just an explanation of how hard it is to develop prevention strategies with traditional counterterrorism measures, even though these are domestic terrorism charges against these actors, when the mobilization happens over social media, over in a meme-based way, and then evolves very quickly to evade bans like on the word Boogaloo. So they quickly become using other kinds of concepts that sound like it. And so it's this constant kind of evolution. And, I've argued before quite a bit that for youth in particular, this cycle of banning and creative circumventing of the bans is actually quite fun for them. So it is part of the, the joy of coding a t-shirt or coding a symbol or a meme actually is evading the ban. It gives them a sense of power and secrecy. They like the fact that people can't figure out whether this might mean something that relates to a Nazi symbol, or it might just be a little desert fox on their t-shirt and not actually referring to Wüstenfuchs, the nickname of the commander of the North African troops under the Nazis, for example. So I think there's a lot to unpack with the use of memes that I can't get into here, but it relates to why we're calling for a public health approach. So I'm spending a little bit of time around that. Just other trends very quickly. We have seen, obviously you're seeing this, I'm sure, I know certainly in Germany, a tremendous growth in conspiracy theories and their intersection with violent anti-government, either sovereign citizen movements, militias, anti-vax, anti-mask, anti-COVID mobilization, anti-shutdown, trucker protests in Canada and the US, sometimes intersecting in social media or in other forms of amplification with QAnon and conspiracy theories. I know, Jennifer, we have an accelerationist specialist on here, but we're also seeing, of course, growing accelerationism, which is a sort of ideologically agnostic tactic that's used by the far right, but also by other groups and ideologies to call for the use of violence to accelerate a sort of end times and collapse systems, social, political, and economic systems. So we're seeing, one of the things we're seeing on college campuses, for example, in the US, we have a project in higher education. We're hearing faculty say that they're increasingly hearing students say things like, there is no political solution. And that's a statement that comes from the left as well as from the right. And it's a statement that circulates online and is not exactly associated with an ideology or an extremist group, but it is essentially a call to violence or a suggestion that violence is the only solution to our current political situation. And we'll hear that about climate change, you'll hear that about reproductive rights, but you also hear that about immigration or other, so it's across the spectrum. We're starting to hear things like that. And I think that's a trend, this sort of anti-establishment and accelerationist, but also tied with a little bit of nihilism in a sense that the time for reform has ended and the time for violence is here. And so that's also a very difficult thing to try to intervene in if you're talking about intervening at the end point, which is typically where prevention efforts in the US anyway have been based. And then of course we have energy crisis in Europe, ongoing kind of economic precarity, a lot of things that lead to grievances against the government, some of which are legitimate grievances about why a bank is being bailed out when individuals go bankrupt over healthcare costs, right? So lots of grievances that are percolating and continue to bubble up in the US and globally and across Europe in relation to the Ukraine war, the crisis, energy crisis, migration crisis, and we expect that to continue related to climate change, to climate-driven refugees, for example, that there will continue to be this opportunistic situation. Finally, in the US, as I'm sure you've been following, we're seeing tremendous backlash against the LGBTQ community happening in a mainstream way and in an extremist way. So this mainstreaming of extreme views, this incorporation of language about groomers, and a call just yesterday from an elected congresswoman, who I won't name, but to have a sort of day of retribution, essentially, against the trans community, that got her banned from Twitter temporarily, at least. I mean, we're having serious mainstreaming happen at the same time, and that's a certain trend that has to be addressed. Okay. So all of that was basically to get to the place where I could start talking about a public health approach. So it's really hard. You can't jump in and talk about the public health without talking about this broader context. So I want to spend the rest of the time talking about the public health approach. And very briefly, before I do that, I want to describe, which I'm sure will be very familiar to all of you, what the majority of counter-extremism efforts have been in the US, at least. I think, to be honest, it's much more developed. What already is a public health approach in Eastern Europe and in Europe, Western Europe, I think across the board, we're seeing in other places, are what I see as the leaders in this effort. So I think when I start to talk about the public health approach, I know Lucas and Zuza say this is new, but I actually think you're already doing it far more than we do it, from what I understand. So I'll be quite curious to hear what you think of that claim in the discussion. So just to describe, for example, in the US, but also the UN, almost the UN and most of Europe's and Australia, New Zealand, I mean, our counterterrorism strategies, for the most part, were developed, at least as they currently exist, in the post 9/11 context. That's when we saw the creation of the UN Counterterrorism Committee. That's when the Department of Homeland Security was created. We began to see a much more serious mobilization around counterterrorism and dialogue about it in a security-based frame, both in nations and at the global level. And so for nearly 20 years, really, that is the framework that dominated. And it assumed that we're dealing with groups that have a hierarchy, that have a chain of command, that have clear manifestos, that have clear initiation rights, that have clear membership lists, that are groups that are identifiable, that have plots that can be interrupted through surveillance and monitoring and infiltration. And those still are and have been the major tactics of our security-based counterterrorism approach. And it's important to note that those approaches still interrupt dozens of plots every year in the US and abroad. In the US alone, I think we had 120 plots or something just in 2021, and something like 40 were interrupted. So, that means a lot were actually executed. Luckily, just in 1 year, luckily, most of them were not hugely, didn't have enormous lethality. So you didn't hear that much about them, but, people attacking hospitals, plotting to attack electrical grids and infrastructure, as well as mass attacks, mass casualty attacks. So those do matter. And in actual prevention terms, then, the US and a lot of other countries, I think, have essentially, but the US is the firmest about this, have basically said the goal of prevention is to prevent an already radicalized person from becoming violent. That's called secondary prevention. So the US has said very clearly that our prevention cannot be used to prevent somebody from becoming radicalized, because that would interfere with freedom of speech, that people have the right to become radicalized. And it's not the US's job at the federal level to prevent that from happening, but they have an interest in preventing a radicalized person from becoming violent. So for years, all of the prevention efforts were in what we would call bystander training, bystander intervention, helping people recognize if you see something, say something, report, how to report early when somebody sees a warning sign, understanding what the warning signs of mobilization are so that you can interrupt a plot. And also what we would call kind of crisis mitigation training, which is training people to prevent a crisis from happening. So either by locking the doors, that's one of the pieces of advice, for example, locking the doors of houses of worship before the worship service begins. So make sure that synagogues have policies in place to lock the doors once the service is beginning, or barricade the doors, how to barricade them. And relatedly, how tactics to get out of a hostage taking situation. So I raise that because, again, I would note that those tactics have saved lives and they are important. And so last year we had a rabbi in Texas who was taken hostage by a terrorist, along with a couple of staff members. And actually he got out of that situation by using the crisis mitigation training he had received from the Department of Homeland Security as part of that prevention training. So, edging closer to the door during the engaging in conversation, and then eventually throwing a chair at the attacker. Those were tactics he actually had learned and practiced during that crisis mitigation training. So I'm not implying that those things are not important. But the way I often describe this is, I don't think any of us want to live in a world, and I certainly don't want to live in a world where, our measure of success in preventing violent extremism comes down to how good we've become at barricading the doors, particularly when we are also seeing a surge in the record-breaking numbers of hate crimes, of propaganda circulating, of all these other measures showing that there's more coming into the pipeline. And so if we just put our mitigation strategies on stopping violence before it can occur, we're destined, I think, that a lot will slip through the net. And so a public health approach says there are other reasons, you can engage earlier and in upstream ways to prevent people from radicalizing in ways that don't interfere with their freedom of speech. And so when you think about when the medical field adopted a public health approach, which is a couple of decades ago, to treating disease, medical disease, what they recognized was that it's not effective to just treat things like cardiac disease or diabetes once they occur, to treat the disease once it has manifested, but that actually you also have to invest in education in communities at the community level in a systemic way to help people understand things like healthy eating habits or exercise, or how their behavioral choices can reduce their incidence of disease. So we began to see every hospital start a healthy heart program, every university, right, have programs to educate people about choices they can make without mandating those choices, right? So you're not saying you have to make these choices. It's not infringing on their freedom of choice or their freedom of speech, but it would be educating them about the kinds of choices. And so the second part of that, though, is we would argue that it's not effective to just educate people about the choices they can make if they live in a context where there's what we would call food deserts. There's not enough healthy food available. There's only fast food in their community, or they have to work 3 jobs and don't have time to exercise, or there's no safe place to exercise. So that's why we would call that systemic change. So you can't just create people who are digitally literate, for example, if you're not doing anything about the flow of propaganda, right? You can't. So it's not enough to only educate. So that's all to explain why a public health approach is needed and what it means. So I argue that an effective public health approach, this is my research lab, my definition that my research lab has now adopted, requires doing it in 4 ways. And I say, and we're really emphasizing this because I will say the Biden administration now, as of last year, is using the language public health approach. I just heard Biden's senior counterterrorism director 2 weeks ago, last week actually said the US is taking a public health approach. But I think mostly what they're doing is delivering DHS prevention resources in communities. And so I don't think they have fully committed to what we're arguing are 4 things that have to happen. The first is, it's not that you're just bringing interventions to communities. You have to root those interventions in communities' needs from the beginning. So it really means it's a grassroots way of discovering what's needed in a community and targeting those needs with prevention. So for example, for us, we work in 4 or 5 different states in my research lab, and all of those communities' efforts look completely different. In Texas, we're working with evangelical faith leaders because they're the ones who need the most help. And in that case, they're asking for help with QAnon conspiracy theories and white supremacist extremism in their congregations. So we're educating pastors, creating toolkits for pastors. In Michigan, where we're also working, the biggest concern is the unlawful militias that are happening. And so we're working on a different type of radicalization, right? And there's also significant leap in anti-Semitism there. So there's content. In another state, they've asked us to come in and work on anti-trans groups that are mobilizing there. So each place where you work in a public health approach has to be first centered on what a particular community needs and has to meet those needs in a co-determined way. And so we begin all of our work with communities with extensive listening, what we call fieldwork listening sessions, sometimes with formal focus groups. And that is something that I think is often skipped over in our country, at least at the federal level, where often a public health approach means we're just delivering the resources that we've created here to communities by creating an office, a field office in another state, and then we'll deliver these resources, but they're not actually generating resources that are modified and created with communities' needs. This is where I think actually all of you are, I'm sure, already doing this far better than we are doing. So it has to be holistic and whole of society. So when I look at what other countries have in their national strategies to counter violent extremism, Norway has 12 agencies signed on to it. Germany has 9 agencies signed on to it. It is not just a security agency problem, but it is youth agencies, family ministries, religious, agencies responsible for religious communities and faith-based partnerships. Labor usually is signed on. Sometimes the elderly, agencies responsible for elder care, because we're seeing a lot of elderly people radicalized to QAnon, for example. So it is a lot of different agencies. That has never been the case here in the US, where it's been 100% of the US prevention resources have been based in the Department of Homeland Security. So it has always been a totally securitized approach. And now we're seeing for the first time, as of September of last year, the Biden administration held a summit on hate-fueled violence and announced that the Department of Education, the Department of Health and Human Services, and even some smaller agencies like the Internet Safety Agency or something it's called, the Telecommunications Agency, would be involved in things like digital literacy and combating some of these issues of disinformation, for example, under the guise of school safety funding that they already have, which has typically gone to security guards. But we can think of safety in a broader capacity. So it has to be holistic, whole of society, including the arts, education, health and human services. The third is that it must rely on evidence-based interventions. This has been a very weak spot of the field, a very strong weak spot of the field, that we often create interventions and don't test them to see whether they work. And I think one of the biggest concerns about that is we know, particularly with conspiracy theories, that interventions targeting conspiracy theories quite often backfire and cause people to dig in their heels even more, to believe the conspiracies even more because you're seen as part of the conspiracy. So we argue that every intervention has to be, not just evaluated for outputs, like how many people were trained or how many downloads of this tool or how many clicks, but did it move the needle, either in a pre-test and a post-test evaluation or in a comparison group study? Did it move the needle in improving knowledge, improving capacity to intervene of the community, improving their sense of confidence, and the efficacy of the community to intervene, and also their sense of where to go for more help. So those are the measures that we usually use on our interventions. So I have here an image of our first tool that we created in the lab, which was a kind of panic-driven tool, I will say, that we launched starting in March of 2020 when the world shut down and all children went online and all people went online essentially. And we knew that parents were not equipped to understand what their kids were seeing online. And so together with the Southern Poverty Law Center, we created this guide for parents. We created it, we focus grouped it with parents and with therapeutic residential therapists who live with adolescents to see what they needed. And that was really interesting. That's part of the Rooted in Communities needs. They told us they don't want a guide that's only focused on recognizing risk. They also wanted strategies to build resilience among young people. So we We went back to the drawing board, did some more research, found out what's happening in the literature on parenting, what are some strategies to build positive identity and ways to talk to adolescents about what they're seeing online. And then we changed the guide to be about resilience and risk. Then we tested it with 750 parents in a pre and post test. And we found out, for example, that it only takes on average 7 minutes of reading for parents to improve their scores, their knowledge, their capacity, their sense of confidence to intervene if they saw a child who was exposed to harmful online content, and their awareness of where to go to get more help. But we also found that there was one group of parents who did not improve on one measure. For example, the most highly educated parents did not improve their ability to recognize online misinformation through our study. And the reason is because they came in so much more confident than everybody else that they could already do it. And then they got less confident when they realized through our guide that actually this is often very coded, it's in memes, it's in online gaming platforms, it might be in an app that's hidden behind a calculator app on your child's phone, like just explaining basic things about youth culture online and how this works and what they might be saying. And so we thought that was important to know, that we both corrected their overconfidence, but also we realized those parents were never going to reach out for help on their own because they don't think they need it. So we then created a video in collaboration with our partner using, the narrator was the mother of a victim of a domestic terrorism attack at a school, who talked about why the white boys who targeted her children, a very credible narrator, could explain these were not, kids that people might think would issue that threat over social media. And then they had to go to jail for 15 months. And, a credible narrator explaining how you can get help and resources and prevent some of this on your own. So all of that's to say that the evidence is really important to study effectiveness, but also to improve the messaging about the interventions and to improve the audience reach and the segmentation, understanding who needs to receive this intervention and how might you need to shift the messaging to get access, to people who might not otherwise reach out. And then the last thing, or the fourth and last thing about the public health approach is what I sort of mentioned at the beginning about the medical part of it, public health, is that it has to include a focus on building resilient systems, not just resilient individuals. So one thing we often see with people talking about a public health approach is that they're then saying, oh, this is just about digital literacy. If we can just teach people how to better recognize and reject propaganda, and we have a lot of projects that do that, for example, then that's all we need, right? And what we're arguing is that's not enough, right? You can't just teach people to be more resilient in a terrible system where there's disinformation coming at them, where they live in regions of the country that are what we would call news deserts, where there's only one type of news coming at them, where they're not able to get access to a broader bipartisan set of media, where there are gaps in broadband access for rural communities. And so they're actually not getting access to fact-checking websites, let's say, or they don't know how to do it. So there's digital literacy, but there's also broader systemic issues in terms of how communities are losing trust, reduced social cohesion. And we often refer to this as reducing the fertile ground in which these things can thrive. So, you have to pair these intervention work with broader anti-racism, anti-Semitism initiatives that also make it less likely that that kids, adults, youth will think it's funny that a Holocaust meme is minimizing the impact or denying the Holocaust, for example, that they will recognize that for the harmful content that it is, and not just in a technical way, but they have the empathy and the historical context to recognize and reject. So that's the systemic kind of issue that has to be there. I have policy recommendations, but I think I should skip over that right now and go to more of the practitioner-oriented questions. I can come back to this, but I'm happy to take clarification questions first, or maybe Zuza, Lukasz, you can tell me whether you think we should go right into the small groups and then come back for the whole time. I'm not sure what would be most productive and effective from your view.
Yeah, I think we can get a chance for some clarification questions first, if there is something you would like to get explained more in depth.
Great.
So please, anyone who want to ask, just go ahead. Maybe if I can have a question.
Yeah.
Because for me it was very interesting listening about evidence-based interventions, because very often this evidence is gathered just by simple questionnaires like before and after, and maybe if you can just a little bit talk about the methods, how you collect the information, because it's not easy to find a very good way how to really was it like interviews or some in-depth discussions, or what was the methodology?
Yeah, this is a really good question. And, we're lucky, we are a research-based lab in a university who creates and tests interventions. So we have the advantage of already having faculty, doctoral students, and postdoctoral students in the lab, in addition to practitioners. And so the research is baked in from the beginning. So we call it a 360-degree approach. It's an iterative research approach, meaning that it starts, no matter what we do, that starts with the listening sessions. And we have been doing a lot of formal focus groups for those, but we're just transitioning now into what we call more fieldwork scans, fieldwork listening sessions, meaning because we're doing on-site work in Georgia and Michigan. So we're actually sending people out to the field and hiring people in the field who live in Michigan and Georgia to have more like preliminary fieldwork ethnographically conversations rather than establish formal discussions. The formal discussions may come later, but we first just need to get a sense of what are people worried about? What do they need the most help with? Who are stakeholders who might be really good partners for us to work with? And there's a combination as we decide how to prioritize our work in a state where we're working in regions of what's most needed and what's the best opportunity to partner. So those fieldwork listening sessions are important for determining our priorities and also the possibilities. So for example, in Texas, there's a lot of work that needs to happen in Texas. We're working with the evangelical community because they came to us and asked for help, and it was a natural partnership. And even though it's a really two different types of groups, we have had this really productive 2-year collaboration that I think is going to be transformative for that community in equipping pastors with tools to recognize and help their own congregations reject some of this and understand some of those warning signs. So that didn't need a listening session to start with in terms of the state field scan, because we already had a partner. So we went right to the focus groups, right to the focus group listening sessions. But in that case also, we didn't do the focus groups because we thought we're not going to be the credible leaders of focus groups with evangelical pastors from our Washington, D.C. base. None of us are members of the evangelical Christian community. So we went and trained the pastors, a group of pastors in focus group interview techniques, co-designed the interview, and then they went and did it. So as trainer of trainers, they ran the focus groups and then came back and reported to us. This is what we heard from our congregations, from our groups of pastors in this region, what they need. So that's part of that community rooted. Each place is going to look a little bit different, but for us, we have full-time anthropologists on staff, full-time social psychologists on staff who are just part of our research team, plus I'm a cultural sociologist and we have a media scholar. So we have several people who are, research oriented and already have their PhDs and do research evaluation. We also then do quantitative testing of everything we do, which is pre and post testing. That's a survey-based platform, or we do control group testing. So we do the control groups a lot of times with our videos, for example. So where we do a lot of short form video work that's called video-based inoculation work. And so there we'll have 1,000 people watch our video, and then 1,000 people watch a video of somebody folding a paper airplane, let's say, and then you ask both people the same questions. And if it's large enough, there's statistical significance of, your video is the one that had the impact compared to this other group of people. So we did that with our anti-vax propaganda, for example, and showed that just in a 30-second video, there was a significant difference in the people who watched our video saying they were likely to go get a vaccine. So behavioral change. That was during the period when vaccines were not yet widely available, but there was a lot of vaccine hesitancy. So we showed that you can, in as short as a video of 30 seconds, by pointing out how anti-vax propaganda works, you can get people to be more willing to take a vaccine. So all of that's to say, I think this is very hard for community-based intervention and prevention groups to do this without research support from university-based groups or people with PhDs who are trained. I think it can be very difficult. So there's two things that have to happen. One, we, for example, all of our instruments, our impact studies, our measures are fully accessible to the public. They're transparent. So we go after funding, we get something funded, and then it's available to the public. So people can use our measures and just copy the pre-test and post-test. And then you would still need somebody to evaluate it statistically. But what part of what we're advocating for is for governments or funding organizations to make sure to include sufficient evaluation funding as part of the part of the grant. So we recommend at least 15% of any grant be dedicated to serious impact study evaluation, not just output evaluation, that allows organizations to hire consultants or to partner with a university-based research team to conduct that evaluation for them. That has not been the norm in our country and elsewhere. The evaluation will be required, but they'll accept just a very descriptive number of people who are trained or the number of downloads. And so you don't actually really know whether it's making any difference or which approach is more effective than another, or which approach might be more effective than another under certain conditions or with certain audiences. So we need a lot more of that type of evidence. And I think that's, in order for that to happen, it really has to come as a part of the core funding, because we can't expect that level of research expertise to be built into every community organization.
Yeah, but at the same time, I think it's important also on a philosophical level, like that you can make mistakes. Yes. Because usually these evaluations, they are set just to confirm that, yes, everything was successful and the money was invested well and that everything is perfect. And I think this is also a kind of mind shift. We all need to accept that sometimes there may be something which just doesn't work and we have to try different way.
Yeah, I mean, I'll give you a quick example. I won't name the city, but we did a pilot training for a city and for lots of reasons, the audience, we agreed to do a preventative training, and then they sent us an audience of employees who were required to be there because of prior violations of things, right? So it was not a preventative situation, it was like a corrective situation. And our training didn't work. I mean, actually it did have evidence that it worked. It showed that it was effective, but on the measures that we measured, but we felt there was such hostility in the group that there could be other impacts that weren't measured. Like maybe this actually polarized the group further or made them disengaged even more. And so our recommendation was don't do this. Do not, like, this was a pilot, but our recommendation was do not expand it, even though like we could have said, hey, the evidence shows this was effective, because actually it did show that on our measures, people did become more knowledgeable, they did become more informed, they did become more capacity improved, and they knew where to get more help, but they also were angry. And so we could have said, hey, this is effective, give us the big contract to do this work. But actually we think it's, you know, we thought there were enough warning signs that it wasn't effective, that the recommendation was don't do it, and we can't recommend that you do it. And actually you can't use our name if you're going to do it. You can't say that this was recommended, because so we put that in writing. And I think that kind of thing is also really important to decide when something didn't work and then go back and think about it. But if we had not piloted that and just went and did the whole city, it could have been, you know, we could have caused harm, I think, or potentially, right? I mean, maybe not, maybe it was just that particular group, but it was enough to make us cautious. And I think that's important.
Yeah, Cynthia, there are two requests from the chat.
Yes.
One is from Michael. To what extent with your work are you able to keep up with the social media context related to all these interventions? That it's very difficult to keep up with all this hate content. So how you deal with it?
It's really hard. I would say we now have 14 full-time employees in the lab, including a couple of people who just are our analysts in the lab. So we have people who spend time in those spaces and then report back to us. But we've also found, of course, we rely quite heavily on other analysts at Bellingcat, at SPLC, at ISD, at IDL, at our friends and other places who are full-time collecting. I mean, one of the things we try very hard not to do, and we sometimes have to work with partners and funders on this, we don't like to issue, we have a massive report coming out in about 6 weeks on youth gun attitudes. That's been confidential research that we've been doing in the US about guns and youth, and we're doing interventions as well. And there's been this big discussion about, do you release the report, which will be ready first, about the national survey data and the focus groups that we did. That was all part of leading to the intervention. So we better understand the context. Or do we wait till the interventions are ready and tested? And I'm lobbying strongly to try to wait, because I don't like to release bad information to the public, you know, without also saying, like, here's some strategies that we know are effective, because that's our mission, right? Our mission is to give communities tools, to equip communities with tools for change. So we use the research for that end, but that means that we're not writing reports just on trends generally in online spaces. And so we don't have quite as much time on the teams to devote to it. We do have a couple of people who spend like 20–30% of their time doing it and write up reports. And when we do interventions, we have a full sweep of a type of propaganda. So we go at that entire propaganda. So if we're going to do a project on anti-Semitism, we go out and do qualitative mapping. We code book the types of propaganda and rhetorical strategies. We usually get about 36 of them with examples. Then we scrape and see what's most salient. Sometimes we then run a national survey to see how does this play out. We did that with both gun attitudes, and we did that with anti-vax attitudes, right? So we survey several thousand people to see which of these persuasive narratives matter the most to them. Interestingly, in both of those cases, the narratives that are most persuasive to them are about safety. So, you know, we find that the propaganda about safety that relates to fear and safety is the most persuasive in both of the cases where we've done nationally representative surveys to see. And so then that says, okay, we have to talk in our interventions about this issue of safety and fear. You know, what if you're hearing this about vaccine safety at the same time that you're getting, you know, videos that are using a giant needle that hasn't been used since the 1950s, or showing you images of crying babies, or using music that's, you know, like Hollywood style music intended to make you feel anxious, or colors that look like vomit, you know, like these things are all propaganda tactics that you can teach people to recognize. And then that makes them more skeptical of the content that they see. That's the kind of videos that we produce. But to do that, you have to understand what's happening in those spaces. But we don't generally do it on a kind of day-to-day basis like you're talking about to keep up. We do it when we're funded to do a specific project, and then we go at it comprehensively. I don't know if that makes sense.
Yeah.
I hope that someday we have fully funded analysts, but that's like part of our fundraising strategy. Right now, the analysts we have are doing that sort of as part of their intervention-based work, because what we're funded to do is interventions.
Yeah, they probably also need some psychological intervention.
I will just also say we have very strict rules about mental health. We don't allow students, for example, to look at that stuff or to report on it for us. And part of the helpful thing about not working full-time as an analyst, everyone's working on the interventions, and the interventions is actually where the most optimistic side of the field is. Like, we've done about a dozen projects in 3 years. Every single project has produced statistically significant evidence that shows you can reduce the likelihood that people are persuaded by this stuff. It's very difficult to disengage people once they're already down the rabbit hole, but you can actually dissuade people from believing it to begin with. So that, I think, is a point of optimism. Like, we're actually equipping communities with tools that can make a difference. So that's helpful on the mental health side, but still, like, it's difficult, you know, to navigate. Particularly, we have a very diverse team. We have a team who are themselves members of a lot of the targeted groups. And that's really hard. And so, you know, just yesterday we were talking about all the anti-LGBTQ stuff that's coming out of this Nashville shooting and how awful it is. And, you know, talking to our staff who are members of that community, we understand this is harder. You may need a little bit of extra time. People can work from home this week if you need, like, finding ways to accommodate the needs that people might have who feel particularly targeted. And so I think that mental health piece is crucial.
Yeah. Okay, there was still interest on these policy recommendations from Boba, and also Miroslav wrote that he's also concerned about the policy and the political will actually to implement some recommendations. But in the meantime, Vladislav wants to ask something, as I understand. So let's give a word to Vladislav, and then we can get back to recommendations.
Thank you very much. Well, I would like to ask, is it possible to share more about the public health approach? And do you think that that applies to other type of radicalizations rather than far-right radicalization? Because from what I've heard, I consider that this type of approach requires serious interplay between different practitioners, experts, policymakers, as well as an open society and citizens who could recognize the issue. So in that regard, I think that this type of approach is applicable in a very few countries, unfortunately.
Yeah, I think, to be honest, the most so the answer is yes. I think a public health approach in theory is applicable everywhere for every type of ideology, for every type of problem, and not just for radicalization to extremist violence, but also for gang violence, urban gang violence, for other types of harm, mass shooting that's not tied to ideology, right? So all types of things that we tend to work on at the tail end, basically, by trying to stop things from happening, but actually could be invested in more at an earlier end. But my hope for it is actually not at the federal level in any country, including my own. I think that this is an approach that is most effective and where I have the most optimism at the local level. And so I think this is communities, towns, counties, districts, and states who are taking this on. And so in our case, for example, I mean, there are states where we are charging ahead with this work because there's political will and there's concern. And then there are states where we will never work at the state level. It's very hard to imagine working at the state level in Texas or Florida, but we have communities who want us there. So we're working with communities on a public health approach within the faith community, or a public health approach within K to 12 educators, right? You can take the approach, the 4 principles, and apply it into a very small community-based approach. It doesn't have to be federal policy or even state policy. It helps if you have state, federal funding resources. And this is probably where the US differs quite a bit from other countries as well. The vast majority of our work is not funded by the government. And, the US has a strong philanthropic tradition, for better or for worse, and relatively low taxes and not very much federal investment in this. And so we are trying to not ever rely on government funding. We'll take government funding, but we don't want to be reliant on it because who knows what's happening with the government? Who knows what's going to happen with prevention resources? It's very unstable, very unpredictable. And so what happens in the 2024 elections, if we're dependent on that, could wipe out all of our resources. So we work a lot with private foundations, with philanthropic foundations who are concerned about disinformation and anti-Semitism, anti-LGBTQ stuff. We work on a contract basis with states sometimes as well. So, we're working where we can work. But I think you could see that the approach is not just something that has to be adopted like by the entire administration. And also I will say, my assumption is like the Biden administration has adopted this, but in 2024, that could all become erased, right? And it might be. And so it's great to have this momentum now to get some things done and to use that public moment for convenings and to speak about it at the White House, as we've been able to do a few times. But we think actually most of the effort should be at the very local level.
Mm-hmm. Yeah, but the situation with financing may be very.
It is different.
Very
Yes.
from the country to country.
Yeah.
Yes. I would like to ask now, would it be okay now to divide into smaller groups and maybe, because Cynthia has prepared some questions we could discuss in smaller groups. So that would be I think useful to maybe formulate some more questions also in the end. And then in the end, Cynthia could also share with us the policy recommendations. Would this be okay with you?
I think that's a good idea. I just put in the meeting chat the 3 questions. And so I think when you split people into groups, they'll still be able to see that. No, is that not the way it works?
I don't know. It's very small.
Okay. Let me see if I can.
Cannot read it properly.
It's also in form of text, Zuza, one message above.
Okay.
Now I can see it.
Yeah.
Now I can see it.
Okay.
So,
Yeah, I don't know why it showed up twice that way, as a screenshot and as but it's in the text directly, those 3 questions, and then I just pasted them individually. I'll do that as well in case that makes it easier.
Now is, I think, perfect. Everybody can read it, and we can split for 10 minutes into small groups of 3 people, and then have chance to discuss a little bit.
Okay, great. Can you? I don't have the.
I will
Yeah,
do
good.
it. I will do it myself.
Great.
And yeah. Let's see how it looks like. Good. Yes. Let's go for 10 minutes. And even if you are not able to discuss everything, it's good just to at least to start maybe thinking this way, what Cynthia is suggesting in the 3 questions, and then we come back and we will report what was the issue you were discussing in groups of 3. Okay. So yes, let me just finish this and let's go. Hello, everyone.
Hello, hello, we are back.
We are everybody back. So maybe shortly from each group, just couple of words. What was the issue you were discussing in this limited time? Please, Lucas, can you report from your group?
In our group, we had a Colombian participant, Michelle, so we were sort of talking about two different contexts, and we realized how different they are. And of course, when Michelle suggested, for example, that it would be great to approach priests, or not, you mentioned priests, but you mentioned different word.
Pastor, yeah,
Pastors,
the
yes.
religious leaders, yeah.
Pastors, you know, at the same time we said, okay, but you know, in Slovakia, maybe portion of the pastors would be rather part of the problem than part of the solution. But as well, yes, that might be one group to approach in order to try something. And then somehow my remark was, and this is on top of my head, and I don't know if I'm right, but I feel somehow that whatever you are describing is so complex that they don't even know where to start with. But I feel like so many of that stuff should be done at a primary level education. And it's just a pity that it's not, at least in Slovakia. It is there, it is in the curricula, everyone knows this should be done, but it's somehow not very well implemented, and that is where we should probably start. But of course, it's not the only thing. So that's shortly from our group.
Thank you, Lucas. Vlad?
Well, we basically we had the same issues with our group. We have different perceptions and about the issue, but mainly we agree on that family and teachers should play a central role. But when you're dealing with students, but when you're dealing with adults, it's something different. So basically, this is our conclusion.
Mm-hmm. Yes, Boba, what about your group?
We were also talking about the role of religious leaders, whether is it positive or negative, but mostly we do not have to forget about their role in our communities, especially in Slovakia. And thanks to Alan's expertise from the fieldwork, we also identified the role of like community and field workers. And we were talking about two particular issues: the rights of trans and intersex people and Ukrainian people in Slovakia. Yeah, a lot of examples and discussions, not enough time to go deeper into the topic.
Yeah, thank you, Boba. And I wanted to, Lenka, ask you to report maybe.
Well, we have Cynthia in our group. As it was said, it was not a lot of time to go deeper. And we just said that there's so many topics that these extremist people are against. I mean, they're just against about everything. So I just, ask Cynthia, what questions or where shall we start? And, if I can repeat, Cynthia, that the first question to start is to ask them what are they worried about. Then it would be
very
huge brainstorming on that side of so many things that they are against and they worried about. But yeah, I mean, it's good to maybe to have a really some good advice at the beginning, how to start, how to approach the discussion. Now, these people sometimes is so confusing, so frustrated, a lot of hate, a lot of fear on both sides. So it's a good advice, Cynthia. Thanks.
Thank you, Lenka. And Miro, can you repeat from our group what was said?
I which part should I repeat?
I
we
mean,
were,
yeah.
we were discussing that many authorities which are shaping, for example, new books for civic education or religious education, and which are a part also members of the team for educational reform, they rather threaten certain stereotypes, and they are not as a group good garants for behavioral changes. But it is possible to identify certain individuals who are competent and who represent that change we wish for, and to maybe influence then this kind of education and popularization, and how to deal with them. I don't know, Zuzana, you can add if I repeated what we have discussed mainly.
Yeah, we were discussed a lot about education, about schools, about the school environment, which was touched in other groups as well. Is there anything anyone wants to add before I give word back to Cynthia? Now there is a room for if you would like to reflect on anything what Cynthia said or what you were discussing in small groups. So please, now there is a chance. If not, yes, Jennifer.
Oh, one thing that came up in our group was we're wondering about guides, publications and guides that could be shared to educate ourselves and others. And I have a couple sitting on my desktop that I've been meaning to get around to reading. So I guess this is a question for the whole group, especially Cynthia, if there are any that you recommend that we could get access to. The two on my desktop one is the SPLC and Peril Addressing Harm Community Guide. And the other is a Confronting White Nationalism in Schools Toolkit, 2nd edition.
From the Western State Center, yes. Yes, great question. So I'm just dropping into the chat our website and also the website that Jennifer referenced that has Peril's resources at it. Our website, in full transparency, we're only 3 years old as a lab. We've been testing and creating a ton of tools and never had the support to build our own website until very recently. So we are launching that's our old website. It's not fully updated with all of our resources, but in about 2 weeks, we'll have a brand new website that is the same address, but is updated and has all the tools. So we have tools for small businesses that we've created and tested, for local governments, for community activists, for parents and caregivers. We have a big toolkit for higher education, which is available now at that website. So some of them are there, but not all of them are there. And we also have all of our impact studies, which are not there yet, but we just haven't had time to get them up. But we now have a full-time person building it, and so it should be there soon. The SPLC Center's website dedicated to us is a site within their site, and that has a lot of the tools, including we have been translating some of them at request. So they're translated into Portuguese, into Spanish, and into German so far, to make some of that content available to places where it might be useful. One follow-up I just wanted to say about the issue of pastors or priests or people being part of the problem, the issue of adults, for example, that Vlad raised. We also find that in every group that we work with, sometimes teachers are part of the problem. Some parents are part of the problem. Everybody has a problematic set of people within them, including some of the faith leaders and religious leaders. So what it's really important is to find someone within that group who is not part of the problem, but understands the group really well and wants to commit. So in the case of our group of evangelical religious leaders, they're worried about what's happening in the churches, what they're seeing among other pastors, and they want to intervene. So, but we wouldn't be able to work with just any random evangelical pastor, because some of them are part of the problem. And so you have to find the right partners. That's one of the really most important parts. And same thing with the teachers, the principals, school superintendents sometimes are also believers in some of this propaganda. And so they're not actually helpful, but others who work within that are worried what they're seeing in their communities and want to engage. So I think that's one of the really important things to identify people who you can work with in these different roles. And we also find, for example, athletic coaches are really helpful. So we work with a lot of coaches, youth coaches, because sometimes teenagers will listen to them when they won't listen to any other adults in their lives. And but not all coaches are, we have coaches who are racist and homophobic and sexist and, part of the problem. And so you have to find the coaches that understand this and then want to intervene and create safer and more inclusive spaces in their sport. And so we find them and we work with them, but it's not a universal issue, right? So it's a cultural change that has to happen from within and over time.
Yeah, Miro, you wanted to say something.
I didn't want to say something. I would like to specify my question, and if it is too long, so maybe we can continue somewhere else. The point is that, for example, faith-based communities, which are very big, and they are under certain influence of their, let me say, church teaching, they usually marginalize those pastors who would like to unveil certain practices.
Yes.
So they are compromised in the eyes of that big part of that community. So they understand the problem. They have different opinion. They would be glad to help, but they don't enjoy the trust of the community, or they are so much compromised in that environment. They had really difficulties to come through to that influence. So how do you deal with that problem? For example, when you have that, that sexual assaults within the church, there were certain individuals that were helping, but they were compromised as enemies of the church and they were not trusted. So you understand what I asked.
Totally. Yeah. I think this gets to, there's two things I think that are really important to raise. One, what we do is work with partners who are within the community that we're trying to impact, and then create a tool that is available to the broader community then. So for scale up and distribution. So we are pilot testing in a small community, but then we're creating a tool that can be available to everyone. And we understand not everyone will access it, but the community that we work with can try to promote through their networks, through their associations, right? And get it out there. And then if you can get it in front of people, you will eventually find others who want to access those resources as well. And I guess that gets to the second related issue, which is we were on a study tour to meet with a lot of German prevention experts last year because we're modeling some of their approaches. And we asked the mobile Beratung folks, the mobile advisory folks, how do you work with people who don't want to work with you? How do you reach these groups that are already, radicalized? And they said, and this is a little bit of an unsatisfactory answer, I recognize, but it's also the approach we're taking. They said, we have so many requests from people who want help that we start there. And you work with the people who want help and who are asking for resources and asking for trainings. And they said, I hope we someday get to the point where we have the free space and the time to go after and try to convert to our cause people who don't, but we don't right now. And so you start where you can. And I understand that's unsatisfactory because it's not going at the most acute problems, but it is working with the willing participants and trying to create change and evidence of effectiveness of that change at that level, and then try to scale up and create the change. So, we're just now in the phase of starting to scale up. So we're partnering with, on our anti-Semitism work, with a museum, right, who works on Holocaust and anti-Semitism work. So once you get a tool that works, where can you go that is a credible and has a broad audience, like a museum or an educational association, the National Teachers Association, you find an advocate at a very large level who can help distribute and get that out to a larger audience. But there will always be a lot of people who don't agree with it at all. So again, it might not be totally satisfactory, but that is the approach that we're taking.
Yeah.
Because there's so much need. We can't even respond to the requests, honestly. So, yeah.
Okay, if there is no other question or comment right now, I would really like at least a couple of minutes spent on the policy recommendations, because we promised that. I am aware that some people already left because they had another duties and engagements. So for those who are really interested and who are still have some time, so please, Cynthia, spend a couple of minutes on that point.
Yeah, sure. So there are basically 3 categories that I usually recommend. So one, and I think we've touched on this already, but one is that there's how do you bolster this public health approach with policy support at either the local, the state, regional, district, or national level. One is there's a huge training and capacity building needs. So we find that even when you have a whole of government or whole of society interest in this approach, state government leaders don't know what they need to know. So if you're getting the Department of Education involved in this for the first time in the US, let's say, they're going to have a grant program on digital literacy, but they don't know the changing landscape, this issue of memes, the way that humor and satire is used, what the range of conspiracy theories is, and they don't know about these research skills and evidence-based needs to evaluate necessarily, right? Some people do, but so you have to have policy recommendations that include not just saying, hey, all these agencies now have to be engaged in the prevention of domestic extremism, but we also recognize there's a need for training and capacity building and staff positions that are dedicated to this, that have the opportunity to gain expertise from people in the field who know. And that's something we've been talking to state governments about, and also mayor's offices. Like, you can't just ask all of your teams to suddenly start doing this with no preparation and no capacity building. So it's really looking at how do you build people's knowledge and awareness. The second is, we have like this type of conversation, I think, is so important because I spend a lot of time being invited to places like Europol or the UN Counterterrorism Committee. Like, there are such well-established mechanisms for cross-national learning on the intelligence and security side, to have regular meetings, but I almost never see that on the prevention side. You very rarely see conferences that bring together practitioners across borders with policymakers working on the practitioner side, on interventions on the primary level, not the same way that you see regular gatherings on the intelligence and security side. And so one of our goals is just make prevention as important as security in the global dialogue and discussions, right? We would like to see more serious exchange, learning. Our study tour in Germany was hugely important on this. So what are the promising best practice models? How can we share these tools across borders? What kinds of translation and adaptation possibilities are there for tools? We have been translating and adapting some tools from Germany with permission, and then testing them in the US. So you can't just translate pure, it's a different context, but you can take, hey, they've developed this thing for small businesses. Can we adapt it and make it, in an American context make sense, and then test it with an American audience and see if it, works. So not having to reinvent the wheel entirely. And again, the need for dedicated staff to coordinate and direct those efforts, to communicate best practices, to share things across borders. And I think one of the things that we have seen in our fiscal budgets at the federal level, like, I was funded by US government money my entire graduate career to study in Germany, to live there for years, to do research on funding mechanism, to live in Poland. I lived in Poland, I studied Russia, and I studied Polish, all with US government money, all of which doesn't exist anymore. So all of that funding is gone. And I think that simple exchange resources and money is really important. That relates to this cultivating next generation leadership. And here by this we mean also not just people who want to go work for the security and law enforcement agencies, but people who are bringing mental health backgrounds, arts and education backgrounds, who have been teachers, who have worked in these other approaches. How can we cultivate them and help them see a future for themselves in the field? So we're running a summer institute this summer that has 20 fully funded spots for young people, early career practitioners, to come and learn about a public health approach. And one of my goals is for people to see that there is a future in the field for them, for people like them. It doesn't have to be just law enforcement. And then finally, it's the capacity and structures for these bigger picture issues. How do you address the fact that not everybody has equal access to the internet or to even news and media coverage? How do you make sure that we're not just training people to be more resilient in a system that's awful? How do you build trust in institutions? How do you build a better sense of belonging and purpose, ensure and strengthen social cohesion? Those are all issues, I think, that are primary, that reduce the flow of extremist radicalization as well. So those are the initial sort of policy recommendations that we are working with, although I'm sure there are others that we're missing.
Thank you, Cynthia.
Yeah.
Final comments or some whatever you want to say, because we are really out of time. I'm aware of that, but there are so many interesting information that we could sit here for a half a day. That would be still not enough. Yeah, again, for me, it is really like shifting the paradigm.
Yeah,
from the, you know, from really working, as you told, working on the tail, working at the very beginning on the nose of the problem. So and invest in people, in capacities, and in maybe looking on the complex issues, not just on the outcome, what is bad. Yeah, as for the question about recording, we will send the recording to the participants who actually participated here, but as a closed link. So please, it's not for public sharing. It's just for us. Yes, you will get this. I don't know about the PowerPoint. Cynthia, are you?
Of course, I can share the PowerPoint. Yeah.
Yeah, we will put it into PDF and we will share it also with you.
Yeah, I'll make a note.
And yeah, so do you have some other questions or comments?
Not for me. Thank you for your generous questions and discussion. I really enjoyed this, and I wish you all well, and I'm glad that you're doing the work you're doing. So thank you.
Yeah, Cynthia, I'm sure this is not the last time we had you.
I'm sure. Yes.
And Lucas is also nodding his head.
Yes, yes. Maybe the beginning of other conversations and collaborations. Like I said, I think this is just essential, and it happens so often on the intelligence and security side. And for me, I know there are conversations, but not at the same level of capacity building that we see on the intelligence side. And I would just like to see that change. And so thank you for the work to make that change as well.
Thank you. Thank you. Lucas, do you want to say some closing sentence?
Yeah, thank you. Thank you so much, Cynthia. It's been really pleasure and good. And as you noted, this is just the start. I really feel that we have dedicated very little time, and we're in fact run over time. So thank you for staying with us. I know this is the nature of the online meetings, but we hope to even see you in person. We will work on that very hard.
That would be an honor.
Sometimes in Europe,
yes,
this part of the world, so we can dive deeper into more conversations. That will be fantastic. So thank you so much, and thank you everyone for attending from US through elsewhere in Europe, all the way to New Zealand. It's been wonderful. Thank you so much.
Amazing. Yes. Get some rest, those of you for whom it's the middle of the night. And I wish you all the best for the rest of your days, and look forward to further conversation.
Thank you Cynthia, very much.
Thank you.
Thank you, everybody.
Bye.
Bye-bye.
Goodbye.
Thank you for organizing this.
Thank you for coming.
Môže vypnúť nahrávanie. Recording.
Nie, Ivana.
Ika, ale asi to prešlo na niekoho iného, tak ja to teraz idem uložiť.